back to my channel. My name is Lysandra Daly. For those who are new here, welcome. For those who are returning residents, hello. I hope everyone had a great week, and right before this month ends, I want to talk about one more disease that is recognized for this month of April. The disease is called Parkinson's, so Parkinson's disease. So I'm just going to go over the most surface level stuff of it. I just want to make everyone aware and understand of what is going on with this disease. So the first thing we're going to talk about is what is Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that affects predominantly the dopamine producing neurons in the brain, in a specific area of the brain called the substantia nigra, however you want to say. So a part of the brain called the substantia nigra that produces dopamine is it's not producing enough dopamine, so the body it's going to progress into problems with the nerves. So you see them have tremors and stuff like that, but we'll get into that later. So now we're going to look at the symptoms of Parkinson's. Now the symptoms of Parkinson's, in the beginning, if someone has Parkinson's, the symptoms may have little to no expression, but as the person progresses in this disease, it will become more evident that this is what the person has, because there are some telltale signs of what Parkinson's looks like. So the first thing is the person may present with a tremor. It usually begins in the limbs, so like the hands and the feet, and it often begins with the hands and the fingers. And this it normally looks like the thumb and the forefinger rolling back and forth, and this is known as the pill rolling tremor. So like that. And then the person may have slowed movement or bradykinesia. Over time, Parkinson's will slow the movement and making very simple tasks difficult for this patient who is suffering from Parkinson's. Their steps may become a lot shorter when they're walking, and it may be difficult for them to get out of a chair if they're sitting, and they may drag or shuffle their feet as they try to walk. Another symptom of Parkinson's disease is rigid muscles. Now the patient muscles may become stiff in any part of the body, and these stiff muscles can be very painful and it can limit range of motion. Another symptom is they may have impaired posture or balance. So they may have problems with their balance, or they may be falling over, they can't keep themselves upright. Kind of like a baby. When a baby isn't able to keep themselves upright, they're constantly falling over. And they may have loss of automatic movements. So unconscious movements that are controlled by the autonomic nervous system. So these movements are like blinking, stuff that is not, you don't necessarily think about. So they may have problems with these movements. And if you can't do these movements, some of these movements are very essential for our daily tasks or daily activities or daily livelihood, and if these people can't do it, then this poses a serious risk to them. They may have speech changes, so they may speak softly, quickly, they may have a slur, or they may hesitate before talking, and their speech may be more of monotone rather than following normal speech patterns. They may have writing changes, and it may become hard for them to write, and their writing may appear small. So those are the symptoms of Parkinson's disease. Now we're going to talk about the risk factors of Parkinson's. So Parkinson's, the risk factors include age, and young adults, they rarely experience Parkinson's disease, and it normally begins middle or later in life. And as the person progresses in age, they're more likely to have Parkinson's. Parkinson's is also hereditary. So if you have somebody in your family, maybe your mom, maybe your dad, maybe an aunt, maybe your grandma, somebody in your family, it can be passed down. So it is a strong risk factor. Hereditary. It's hereditary. And sex, males are more likely to be affected by Parkinson's than females. And exposure to toxins also increase your risk of developing Parkinson's. These toxins are toxins such as herbicides, pesticides, may slightly increase your risk of developing Parkinson's disease. So one such thing that researchers have identified is a structure called Lewy bodies. So these are clumps of specific substances within brain cells, and they are used as markers to identify Parkinson's disease. These Lewy bodies hold an important clue to the cause of Parkinson's. Okay, so now we're going to talk about the complications of Parkinson's disease. And some of these are thinking difficulties, they may have dementia, or they're unable to use the cognitive part of their brain to make certain decisions. They may have depression or emotional changes. They may have swallowing problems, and they may have a lot of saliva accumulating in their mouth, and this can lead to drooling because they can't swallow. So if they can't swallow the saliva that's being accumulated in their mouth, they just end up drooling. Another problem that they may have is chewing and eating problems. So in the late stages of Parkinson's, people often have the muscles in the mouth are affected. So the nerves that are supplying these muscles of the mouth are not able to stimulate the muscles, so you can't chew food properly. So they may have poor nutrition and poor diet because they're unable to chew certain foods. They may have sleep problems or sleep disorders, and they may have, people with Parkinson's, they may wake up frequently during the night, and they may wake up early and fall asleep during the day. They may have bladder problems, and they may not be able to control their urine, and they may have difficulty while urinating. People with Parkinson's also can be constipated because they have a slower digestive tract. So everything is moving so slowly, so they may have problems with constipation. So there isn't much information about the prevention of Parkinson's because the true cause of Parkinson's is unknown, but there are no proven ways to show that this, if you do this, it may not cause Parkinson's disease. But some research has shown that continuous aerobic exercises can reduce the risk in Parkinson's disease. Let's talk about the causes of Parkinson's disease. So Parkinson's disease, remember, I was talking about the substantia nigra before and how it is unable to produce dopamine. So Parkinson's is caused by a loss of nerve cells in a part of the brain called the substantia nigra. This leads to a reduction in a chemical called dopamine. And a lot of you know dopamine as the feel-good hormone of the brain. So yeah, and dopamine plays a very important role in regulating the movement of the body. A reduction in dopamine is responsible for many symptoms of Parkinson's disease. Because remember earlier I was explaining what Parkinson's look like, and a lot of it has to do with movement. Remember the pin rolling, the tremors, the falling over because they can't keep their posture, things like that. The exact cause of Parkinson's is currently unclear, but most experts think that this is a combination between genetic and environmental factors. So to diagnose Parkinson's, there is no blood or laboratory tests that are done to diagnose Parkinson's disease, but doctors usually diagnose Parkinson's by taking a detailed medical history and performing neurological examination on the patient. So now we're going to be talking about the treatment, how to treat Parkinson's disease. So remember, well, I don't know if I said it before, but currently there is no cure for Parkinson's disease, but treatments are available to make it a little bit easier to live with. So really and truly, this treatment is really just to maintain the person's quality of life, to not make it that hard for them, because it is a disease that is debilitating. So these treatments include physiotherapy and occupational therapy, medication, and in some cases brain surgery. And as Parkinson's progresses, the disease can get worse, and it can become increasingly difficult to carry out normal daily activities. So many people respond well to treatment, and only mild to moderate disability. They may experience mild to moderate disability, but there is a minority that may not respond as well, and in time they may become severely disabled. So that is it. That is everything that I have on Parkinson's disease. Remember, if you want to do more reading, you can do more reading on your own. But this is just to give you a basic understanding of what this disease is and what it looks like, and how to approach, not really how to approach the disease, but how to seek medical advice. So if you feel like you have a family member who are exhibiting these symptoms, or they may look like something is not right, go to your doctor, your general practitioner, if you can find a specialist, you go to a specialist. If you go to the hospital, go to the hospital, get medical advice. Remember, I'm not a medical doctor. I'm just here giving information and educating people in the best way that I can. So thank you guys for watching, and I hope you guys learned something. Remember to like, share, comment, and subscribe to my channel, and I will see you in the next video. Thank you guys so much for watching, and I wish everyone a blessed week, and everything goes according to everyone's plans and everyone's wishes. And thank you guys. Bye.